So for this discussion, I'm going to go over Plaquenil, or hydroxyquinolone, which I'm sure you've heard a ton of information about. And recently, the President of the United States came out and said that he was on it, and he was broadly attacked for taking this medication as an off-label med, and that there wasn't significant evidence to support him doing this. Well, I'm going to tell you what the reality is amongst doctors. When this crisis first came out, I can tell you that we all started talking with each other, and there was good studies out of Asia that looked at SARS outbreak years ago, and Plaquenil, or hydroxyquinolone, was effective in decreasing the duration of that infection and the intensity. So basically, every single one of us went out and started prescribing it for each other. I tried to get it at a pharmacy, and I happened to miss it by one day. The state put a lockdown on it, and I couldn't get it for myself. My friend, who's a physician, called me and said, "Hey, I have 60 pills for you. If you or your family need it, I've got it for you." And the other recommendation was a Z-Pack and a zinc supplement. So one thing I want you to understand about being a physician and treating patients is there's no silver bullet in anything anywhere in medicine. So when Fauci stands up and says, "Hey, this isn't a silver bullet," I want to hit him upside the head, because I deal with this all the time. When I treat a patient for chronic pain and I give them gabapentin, I'm not expecting a 100% solution. I'm not expecting 90%. I'm hoping for a 20 to 30% improvement in their pain. And that's like that across the board with anything. You want to talk about cancer? We basically give you statistics like, if we do nothing, you'll be dead in 5 years, 75% chance rate. If we do radiation, we drop it to 50. If we do chemo and radiation, we drop it to 30. But there is no magic bullet. So what we have to do with this crisis is take every little thing we can, and if it moves you in the direction that you're going to have a better outcome, then we take it. If it moves you in the direction that you have a bad outcome, then we don't do it. And so what we've done with this program is talk to you about various supplements to take, health steps you can take when it comes to diabetes, high blood pressure, asthma, and every little thing is going to push you a little bit in the direction of increasing your odds of having a good outcome, or push you in the direction of having a bad outcome. And that's medicine. So is there a study to say it works 100%? No. But the other thing to think about with this is when they talk about these arrhythmias, that's in a subset of patients where they were given this medication when they were at end stage, when they were basically ready to die. Well, I can tell you when these people are really, really sick, they're prone to arrhythmias already. So was it because of the medicine? I don't know. But I can tell you that doctors are all taking it. So I have a friend in New York who takes care of these patients. He got sick, he went on it right away. He tested negative for the virus, and he said, "I don't care, I don't believe the test, I'm still taking it." So wrap your head around that concept that there is no silver bullet in medicine, and all of these things are additive to increase your chances of doing better, or additive to decrease your chances of doing well. And hopefully, if you do all the right things, you'll get sick, have a fever, and get better sooner, as opposed to getting sick, going into multi-system organ failure, and dying from it. And that's another concept to understand, is that it's not a zero-sum game, that if you can just tilt it a little bit in the positive direction, that may be enough to not get cytokine storm and go into full-blown organ failure, etc. If we can do all these things, like maintain your blood sugar, control your high blood pressure, supplement with vitamin D and a variety of other supplements we've talked about, and minimize the exposure, you've got a much higher chance of doing well than not. So I hope that helps, but keep that in mind when it comes to these treatments. There is no silver bullet, but if it helps you even a little bit, you probably might want to consider it.